Et voilà, quand nous sommes dans Topik conversation pour ça mardi bon matin et pareil moi je dis plus bonnet aujourd'hui pour encore une fois nous raisonnons encore avec Dr. Suganya qui nous raisonnement bien sûr pour une autre conversation qui nous continue à faire et cette fois-ci aujourd'hui bon matin nous tous bonne madame un petit peu nous peut cause un petit peu le white discharge comme petit si c'est assez sensible là bon matin pour certains nous mais seulement nous pour besoin si c'est que nous besoin adresser nous pas capable l'espace bien sûr pareil nous capable dire en créole bonne décharge qui nous bonne madame parfois nous voit et nous demande question est-ce qu'il est normal est-ce qu'il y a un traitement qui soit bonne prévention qui problème quoi qui cause ça bonne décharge aujourd'hui bon matin c'est ça topic qui nous aborder aujourd'hui bon matin Dr. Suganya il nous donne bon matin pour un mot pour que c'est une cause un petit peu plus créole qui dernière fois les temps bonjour.
Bonjour, bonjour.
Comment ça va?
Moi bien, merci.
Bien dormi?
Moi bien, moi bien.
Bien dormi? You're learning Creole fast, hein?
Yeah, mon père parle Creole.
That's good.
Man, I love Seychelles. Mon kotao, Seychelles.
Kotao, c'est ça.
Yeah, c'est ça.
Voilà, pour apprendre Creole, chaque fois qu'il il apprend plus. But don't learn the bad words.
Yes, Carol, for sure.
A mixture of it.
Yes, you keep telling me. I keep reminding myself. All my patients teach me proper words so I can communicate and understand better.
Yes.
That is the main idea here.
So when you are consulting with your patient, do you sometimes speak in Creole?
Most of the time I try, like Winnie, SSA, mon père Winnie deme. Small words I can coin together.
Doucement.
Yeah, bisma. Yes, yeah.
Voilà, c'est celle, Dr. Suganya, qui est content, qui a envie en effet d'apprendre qu'on cause créole, nous connaît tous les mois. Et ici, c'est celle, il vient une semaine comme ça. Docteur Mouti, bien sûr, quand il fait une bonne consultation, dans tout quelque chose, il y a un gynécologiste, bien sûr, mais souvent, il y a tout quelque chose aussi qui fait, par exemple, son poste, qui nous voit, mais aujourd'hui, par exemple, nous dit, nous peut causer white discharge. What causes white discharge?
I really want to highlight on this white discharge because I need to create the awareness what is normal white discharge and what is abnormal white discharge because all women tend to have discharge per vagina normally. So whenever a girl attains menarche or puberty, she can experience the white discharge. This is normal. And during her pregnancy, the hormonal changes can cause a discharge per vagina. Again, it is normal. And during a month, in the mid-cycle, say it like 14th day of the cycle, or 2 days ahead or 2 days before the ovulation or after the ovulation, the women can experience the discharge. This is perfectly normal. Now, highlighting on the discharge, the texture is actually watery or jelly-like.
Or gel-like.
Gel-like. That is the normal white discharge.
Considered normal.
It's very normal. It has to happen. And once it happens, it says the hormonal pattern in the women is perfectly all right. And there is enough lubrication happening in the vaginal flora. And it helps for the woman to keep herself fertile, and the flora or the environment required to receive the baby is also created by this discharge. So it is actually a normal phenomena happening for every woman, but we need to be aware when it crosses the boundary.
Yes. When it's considered normal, it's normal. Par le docteur peut dire, ça va pas expliquer là, totalement normal, mais là, pas normal. When do we say it's not normal?
That is a very nice question because most of my patients get panicked because they see white discharge and they keep the liners telling me that it is soaking. Actually, the discharge can be considered as abnormal when it is present throughout the month, when it is present
almost daily.
Almost daily you can see the discharge. It is smelly.
Yes,
it can sometimes very bad smell, stingy, or it can cause itchiness. The texture can get converted from gel-like to cuddy white.
And the color can change.
Color can change from clear to, a dark yellow or light yellow or yellowish green or even curdy like an yogurt color.
Yogurt.
So all these changes says that this discharge is not normal.
What do we do? Do we report? What do we do?
Yes, whenever the woman notices this abnormal kind of discharge, the itchiness, the smelling, foul smelling or the color change, she needs to approach the gynae and check herself up. What is the reason behind this abnormal white discharge? This is not considered to be normal. And yet another thing here is, if she is indulging in active sexual life, she can transmit this current infection to the other partner as well.
Mesdames, nous connaissons les corps très bien, nous. Alors, nous connaissons l'état quelque chose qui est abnormal, qui tous les jours, il ne devrait pas là. Alors, the first thing, c'est que nous report to our gynae, Paris, il peut expliquer. Can it affect sexual activities?
Yes, of course. The woman actually doesn't feel good because of the discharge. You see, the discharge actually coats the vagina and coats the cervix. So during the sexual activity, when the discharge is in excess, it is going to rub the skin inside, the layer inside. So the layer covering the vagina can be irritated, can be broken, can cause, the infection which is outside can get inside the uterus as well. And it can definitely cause some pain to the women, causing uneasiness during the sexual activity.
Voilà, madame, nous prenons un petit peu plus soin avec nous les corps, parce que nous pouvons dire ça, signe avec symptômes qui nous peut aborder là bon matin, si vous remarquez, plus vite possible, et plus bon qu'ils report, bien sûr. But if it continues for days, weeks, and the woman does not report yet, it goes for weeks continuation, what does that mean?
Okay, now that is a very nice question, because most of the women are hesitant to approach the gynae.
Yes.
Or feeling shy to tell that I have a discharge.
We tend to do that. It will go away. It will go away without consulting the doctor.
Of course, girl, it will go away. But most of the women don't approach the gynae feeling shy that they have the discharge. And second factor is they are afraid that it might be something dangerous. So they don't want to face the fear of knowing the reality. So if it is left ignored, this discharge, which is sitting outside, can creep up inside the uterus, causing pelvic inflammatory disease, which means the whole of the uterus gets infected and it is filled with, pus. We say this yellowish discharge that is going to become very dangerous to the entire health of the women in toto, landing up in sepsis as well. So a simple white discharge, which can be treatable, can land up in her life-threatening situation, like ending up in septicemia.
Yes, ça veut dire, nous, bonne madame, on reste très, très concernés avec nous les corps, bien sûr, par nous dit des choses qui est normal, tout à fait normal, mais seulement ça qui est abnormal, we have to be concerned, nous besoin rapporter. When do we have to be concerned?
As I said earlier, when the discharge is present in excess, when the color changes, when the texture changes, when it is smelly, it is definite for the women to approach the gynae and go for a checkup. When the woman walks into my chamber reporting white discharge, the very first question I put through is, like, for how many days you're experiencing, what is the texture, and how bad it is. So once the woman opens up, then when as a gynae, I do an examination and look at her discharge and feel the texture, the color, the smell, and when we put a speculum inside an instrument to see the cervix and find out whether the infection is sitting outside or reached up into the cervix, or the reason for the discharge itself is not the vagina or something way up high inside. It gives me an idea, or the gynae a clear idea, what is the possible reason for the discharge for vagina.
Voilà, si madame Mamzelle Zis rapporté, bien sûr, que docteur Suganya, sa semaine, et que docteur Mouti, bien sûr, ou capable, sous expérience, sa bonne desaz, bien sûr, sous considéré normal, ou bien sous wali abnormal, ou capable, toujours capable rapporter. Donnez un petit call, que docteur Mouti, mettez rendez-vous pour voir docteur Suganya, bien sûr, visiting gynécologist pour sa semaine. Et aussi, nous pouvons causer un petit peu l'option option qu'il y en a, traitement. What is the available options?
Yeah. So the number one will be, as a gynecologist, I have to find out what is the reason, what is the possible infectious origin, because the cause can be bacterial, the cause can be fungal, the yeast, the fungal, or worst case scenario, it can be viral. Viral, yeah, that is the worst case scenario. All three put together, or the last one, a combination of all four. Because if the bacterial or the yeast is ignored, the fungal and bacteria join hands together and create a huge infection inside. So that is a real challenge for a gynae to treat the white discharge. So we need to make sure what is the factor, what is the organism sitting behind the discharge, for which we do a swab. So when I take a swab and culture it, we can find out whether it is bacterial or whether it is yeast. It's a very, very simple test. It is not painful.
Is it uncomfortable?
No, it doesn't hurt. It is perfectly fine. All the woman or the lady or the girl has to do is just relax, breathe out, and allow the gynae to perform the procedure. It's a small stick like a swab, just placed inside and taken out and send it for culture. And by the way, if I find the discharge is in excess, then the treatment, apart from taking the swab, changes there itself. Like advising the women to go for the second level of treatment, which is like a biopsy and a dosing, a cleanup, which is required.
How often is that biopsy?
The biopsy is very mandatory when I see the cervix getting infected. When I see the discharge pouring from the cervix, I always make sure my patients understand the importance that this infection is severe and it is not lying something inside the vagina, it is coming from the cervix or from higher up. So the biopsy is mandatory. Why again I'm insisting on the biopsy is because the cervix is actually the cancerous origin for...
I was going to say, for the benefit of our viewers today, can it be potential for cancer?
Yes, it is a highly potential indicator of cancer because, as I said, the worst case scenario, the cause may be the viral, the human papilloma virus can become cancerous because it is a triggering agent for a cancer cervix. So the epithelium covering the cervix, why I put it in simple terms, like we have the skin covering the hand, the cervix has got a layer. This layer has got very sensitive to this virus, the human papilloma virus, the HPV virus. When this layer is exposed to HPV virus frequently, the layer breaks. Like in a skin, when we break, like the wound doesn't heal often, similarly inside the cervix, once the virus enters, it doesn't heal. It shows itself like throwing heavy white discharge, which is an indicator that she needs a biopsy. And I'll highlight on biopsy what is biopsy, because people are very afraid thinking about it is a very big procedure.
The direct way to, when we say biopsy, we think that's the direct way to cancer. Biopsy cancer. This is what we think.
Yes. I want to make it very clear, Carol, here that biopsy isn't an indicator that the patient or the woman has got cancer. All it is going to do is help a gynae understand whether it is cancerous or whether there is a possibility of getting converted into cancer in the forthcoming years. That is what it really helps. What we really do, I'll put it very briefly. We just do it, make the patient relax and just take a small tissue, very, very small. We have a special equipment, and it just takes the exact pinch of tissue, like a size of a small half-cut pepper. You know, the black pepper, when it is cut in half, only a very small bit of portion is
Petit 10
required.
poivre, hein? Si nous pouvons imaginer, docteur peut dire de black pepper, ça 10 poivre, il prend sa petit bout là. Pareil, un petit point de poivre, docteur peut dire là.
Yes, the size of the pepper that helps us makes a slide. We prepare the slides and we study the layer covering the cervix, and we study what is the layer, whether it is damaged, whether it shows the atypical cells, which means the cells are deranged, the cells are abnormal, the cells are overgrown, which is an indicator. Then it is the earliest diagnosis that can help the woman, and you know, it is a real life changer. You know, it is a second chance. She can get the treatment, grab the treatment, and get this off her body and get herself in best of her health. La santé.
La santé, voilà, docteur, il finit avec un petit bout de temps. Ok, la santé, c'est celle, nous pouvons besoin prendre soin beaucoup avec nous, les corps. Nous dit, it can trigger, il besoin, il vient menace, bien sûr, pour cancer, si nous pas traiter. We have questions from our viewers, doctor. One say, good morning, Carol. Good morning, doc. I have a question. If I'm having irregular period, should I be concerned?
Yes. Good morning, dear. Yes, this irregular period is a real concern. A woman has to have her period every month to become pregnant or to have a fertility ratio. If she is, the normal range is somewhere between 25 to 32 days. In between the 25 to 32 days, the woman has to have her period every month. This is the normal pattern. Anyway, it crosses beyond or occurs frequently, it is definitely going to affect her fertility ratio because the hormonal pattern is really not helping her.
Voilà la réponse pour aux questions. Another question from our viewers, c'est bonjour. What about teenagers? Can they get bad discharge? Can they get bad discharge?
Oh, bonjour. I really want to highlight on this because, as I said, when a girl attains puberty or menarche, she can experience white discharge. But what is a concern here is educating the girl that this is kind of a normal and has to tell her mother when it is flowing in excess or smelly. And yet another thing I find here in Sisal is the fabric they use for the console. The fabric sometimes can be worn very tight, and the aeration, the ventilation is affected. So when the ventilation is affected, the sweat inside soaks the console, and then it attracts any wet tissue, you know, it attracts germs. So
And that is not good.
that is not good at all, Carol, not good at all. And that needs to be taught to the girl that she needs to have her console loose and free whenever and wherever possible. And then the excess sweat she has to maintain her hygiene importantly. The local hygiene is very, very, very important. Changing the console and washing her clothes. Sometimes the girls can be allergic to the fabric. So they have to understand, first and foremost, the girl has to talk to her mother that she has this kind of a problem. Then maybe she can approach the gynae. Yes, it is a concern if it happens in the teenagers.
It is a concern. Voilà la réponse pour aux questions par le docteur. Il expliquait, bonne petite fille, bonne petite madame, adolescent, mademoiselle, madame, bien sûr, nous besoin concernant le docteur. Il explique un petit peu, bonne condition qui nous mettait faire si pas trop serré, pour donner un petit peu l'espace, bien sûr, si tout, tellement dit madame, nous transpire beaucoup parfois, alors ça, nous besoin prendre bien attention, faire si il y a extra. Petit condition dans ça, comme bien si nous transpirons, bien dans notre période, à cause de la fabrique, par exemple, qualité de la toile qui nous met nous conditions avec, parfois, il y a des gens qui sont allergiques avec. Alors, c'est pas faire trop serré, nous, quand nous bien, en de petits décors, bien, mais sûrement là-bas aussi, il concerne, alors, c'est fait si, quand nous bonne fabrique, il concerne. Et pour qui peut de côté docteur Suganya, il était situé dans le bâtiment, côté docteur Mouti en ville. Bien sûr, si vous pouvez aller, je vous donne un petit call pour mettre un rendez-vous. Bien sûr, and more question coming in, how to stop it naturally?
All right. This is very nice question. There is nothing called stopping it naturally when you have something abnormal inside. So, first thing, the woman has to understand which is normal discharge. So, we leave aside, as I highlighted, during her period, during her pregnancy, during her ovulation. This time, when it is jelly-like, she can just use warm water to wash the area. Do not use soap, do not use shampoo to wash the private parts, Carol, because the pH is altered in the vagina. The natural flora in the vagina which protects the women is disturbed. So, never use soap which is acidic, because the vaginal pH is alkaline and it is needed to maintain the healthy part of the vagina, cervix and the uterus, and in toto for the fertility as well. So, never allow the girl or the woman or the lady to use soap or shampoo to wash the private area. Always use very clear warm water to wash the private area. Just in concern, she can approach the gynae and collect certain liquid which is available to wash the private area and keep her very clean.
Otherwise, just have your shower, normal shower.
Yes, normal
without soap.
shower, yes, without soap. Soap can alter the vaginal flora in a drastic way that it damages her.
Voilà. Nous bonne madame, s'il vous plaît, le temps nous peut bien faire si pas servir savon par le docteur il dit à cause qu'il il naturel pas ou bien normal de l'eau bien seulement pas servir savon à cause ça est naturel. More questions coming in. It's in Creole, this one. Bonjour Carole, moi une question si ou le bon implant contraceptive implant ou power period dit tout est-ce qu'il est OK et normal à cause ça contraceptif pas peut faire ou voir au period. Did you understand that?
Yes, because of the implant.
Je understand Creole.
Mercy. Okay, I just want to explain.
Yes.
Because of the implant, she can experience a change. Yes, she can experience a change because all implants, contraceptives are, hormonal. Whenever the hormone is implanted or injected in her body or in a woman's body, the hormone is released in pulsatile way. Like in a month, it shows one spike. And in the next month, another spike. So, in this way, it changes the ratio of the entire hormonal pattern of the lady, which affects the whole fertility pattern and the discharge or the vaginal pattern or the maintaining the flora. So, before going in for an implant, it is ideal to have a gynae checkup. Don't go over the counter and get an implant done, because the lady has to be assessed, because for a contraceptive implant, there are certain criteria that has to be met. Like she should not fall into the dangerous criteria like over obese or like morbidly obese, having some metabolic diseases like diabetes, hypertension. No, all these implants, contraceptive devices are hormonal, Carol,
yes.
And that can change, then can cause a huge change in the metabolic activity of the women. So it is always ideal for the women to approach the gynae before having an implant.
Voilà, la réponse pour une question est très sensible, mais très importante pour capable approcher un gynécologiste pour gagner plus l'explication, gagner consultation. Merci. And then là, je take it the way forward. I want to ask doctor about the food.
Yes.
What to eat, what not to eat regarding the discharge.
All right, that is a very nice question, Carol, because we need to understand what is healthy for our body. And per se, there is no such food that causes white discharge. This is a very clear idea. I want to place it for all women out there and understand this particular food can cause white discharge. But there are certain vegetables or allergic criteria that can increase the itchiness of the discharge which is already existing. Say like eggplants, no, the brinjal or the eggplants can cause like increased itchiness.
Eggplants, huh?
Yeah.
Brazil.
Yeah, yeah.
I love eggplants.
But, you know, that is what I say. Allergic response of a woman varies from person to person. And if the alkaline pattern of the vagina is altered, then anything that is acidic which is taken, and to put it in brief, the alcohol, the consumption, sorry to say that.
Sorry to say that, doctor.
It is a very, very dangerous, you know.
Madame, nous sommes fair, nous, hein? Tobacco.
Not fair.
Ah.
Yeah, the spirit or the alcohol changes the entire body ratio of the pH from being alkaline to acidic, and you know, aggravates the chances of getting infected with the by altering the vaginal flora. So consumption of alcohol is not good for health.
It's a no-no.
It's a strict no-no.
It's a strict no-no, doctor.
Yeah. Oh yeah.
Oh la 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 la. It's a strict no-no, docteur. Veillez un petit peu le brinzel aussi, le docteur dit, eggplant aussi. It can be a factor. Il y a aussi tout ça là, pour bon que quand on brinzel, nous quand on brinzel dans nos curry, docteur. We love the eggplant in our curry.
Yeah, it is very good and it has got a lot of antioxidants. What I'm trying to put here is the itchiness, if it is present, can be aggravated by the certain oxidants present in the eggplant. So, for some it might be reactive, for some it might not. That is why I insisted approaching the gynae is important and analyzing what it is, because whether it is bacterial or fungal, it is very important. If it is fungal, then if it is yeast, then the eggplants can be, you know, until she gets treated for a day of like 3 or 5 days, she can refrain and she can have her curry again.
Yes.
Yeah, oh yeah, eggplants are good. Very good.
But the good news is that whether it is normal or abnormal, there is treatment.
Yes.
It can be treated.
Yes, condition, less solution. Every
Solution.
condition has got solution.
Tout problème est une solution.
Yeah.
You want to say that?
Yes, the problem ka solution.
More question coming in. Bonjour, Carol. Bonjour, doctor. What about woman who is experiencing dryness and don't have a normal discharge?
Yes, this is very important because the dryness affects the sexual libido, the libido, the interest,
libido.
the sexual activity, because there needs to be this discharge actually gives enough lubrication during the sexual activity. When it is not there, it is like rubbing the dry skin and causing damage, aberration, and hurting the lady, affecting the sexual pleasure in total. So the dryness has to be attended. One common reason for dryness is the hormonal downswing during the perimenopause or premenopause or during menopause. The second reason for dryness, Carol, I really want to insist here, stress and anxiety.
Stress and
We
anxiety.
can never underestimate the effect of stress and anxiety that can cause the changes in any person. The stress or anxiety or depression causes dryness, starting from the dryness of the mouth to the dryness of the vagina. The whole body reacts when a woman is stressed up or when a woman is tensed. Very true, very true. And the third most reason, diabetes, again causes, the change in the entire body pattern, and it can again result in common yeast infection because of dryness of vagina. So this has to be attended, and we need to, as a gynae, I need to understand whether it is simple stress or anxiety or depression, or the woman who's undergoing some huge turmoil personally, fighting her own battle in her very own way, not understanding this dryness is quite because of the stress hormones, and which doesn't require any medication except the relaxation and the breathing technique that can bring down all her stress hormones down and hacking all the happy hormones like serotonin and dopamine. Rice can change the entire dryness to bringing her back in the normal lifestyle.
Normal treatment. You don't
Yes.
need any other medication.
Yes.
What about, doctor, I want to ask, perimenopause and menopause?
Yes, during the perimenopause and menopause, there is no more estrogenizing hormone released from the women. So, when the estrogen is lacking, obviously the vaginal layer doesn't respond, because now the vagina is like seeing where it can receive some spikes of estrogen. You get it? So, it is looking everywhere and it is not getting it from the body. Then it shows the dryness and the layer cracks up, and once the layer cracks up, the dryness sets in. When the dryness sets in, then she attracts infection.
Voilà, pour aujourd'hui, bon matin, nous pouvons demander bonne question. Il est nécessaire, nous, bonne madame, nous pouvons profiter comme un docteur est là pour nous demander autant de questions qui nous sont capables, mais quelque chose qui nous partie connaît. We didn't see it coming. Mais tout ça là, il est important. Pour qui peut demander, quand qui docteur pour là, docteur, until when you are here in Seychelles?
I'm here until the 28th of September. I'm trying my
28, le 28 septembre.
Yes, Septembre.
Septembre. Le 28 septembre, 10 septembre. Le 28 septembre, il pour là, Dr. Mouti. Another question. Morning, Carol. Morning to you, doctor. My daughter had a chip implant for 6 months and she is not having her period. Is it normal? More than 6 months not to have a period?
No, it's not normal.
It's not normal.
It's not normal. When a chip is implanted and she's not experiencing period, it is something very, very necessary to get her evaluated. I don't know who the lady is, but please approach.
That's a mom.
Yes, the mom, please approach the gynae, or I'm here at Dr. Muti's. She can bring her daughter, get herself evaluated, because the girl has got exposed to huge amount of hormones that is not allowing her body to respond and have her bleeding. So, whenever an implant is injected, it shouldn't alter the menstrual wave or the menstrual cycle. So, when it is altered, please approach the gynae. It is mandatory to check the gynae and check with the gynae and make sure it is not a huge hormonal shift or something, or there is a condition called implant failure. We should not miss something big inside.
I'm going to say maybe it's a hormonal shift,
Yeah.
but my dear, just get in touch avec Dr. Suganya avant il quitte ses cellules. Là, ça une question qui me demandait à cause par dit, il pas normal. You should report avec Tiffy, qui ban quelque chose qui peut passer. Bien sûr, après il y a nous what's the way forward à cause un petit peu beaucoup 6 mois et là il est considéré comme pas normal. Dr. Suganya. OK. Pour qu'il fait nous qui demande si capable d'affecter une activité sexuelle, oui, il est capable d'affecter. Le docteur Tindi, il est capable d'affecter une activité sexuelle. If you had a sudden increase in discharge that continues, what does that mean? Tout ça là, nous dit, mais seulement just briefly, just for those who has just joined us this morning. The
Yes.
question, yes.
Sudden increase.
If you have a sudden increase in discharge.
Okay, sudden increase in discharge again is not a good sign. You know, the sudden increase can be occurring because of pregnancy as well. We never knew, because the hormones
can be pregnant. We don't know.
yeah. That is a normal reason for having excessive discharge for vagina all of a sudden. The woman is perfectly all right, has a very clean hygiene, a very good lifestyle, then all of a sudden she throws heavy discharge. Then the first thing that should strike is maybe pregnancy.
Maybe pregnancy.
Yes, fingers crossed.
Fingers crossed. Go see your gynae.
Maybe pregnancy. And second thing, she might be ovulating, super ovulating. There is a condition called super ovulation where she is ovulating in excess. The eggs are released. So that again is a reason for, excess discharge. These are all normal reasons for excess vaginal discharge. But condition compliqué is when she attracts infection, she throws excess discharge.
Chez Madame Mamzelle, aujourd'hui, bon matin, un peu quelque chose nous peut apprendre aujourd'hui. Alors, il y en a des façons. Un white discharge est considéré normal, mais souvent il est considéré aussi abnormal. Nous causons toutes les façons quand il est considéré normal, quand il est considéré pas abnormal. Alors, pour tirer tout au doute, ou qui peut créer un message rapporté. Là, comme le docteur Suganya, il l'a le docteur Mouti pour la scanner le 28 septembre, rapporté pour voir si nous avons quelque chose, au moins qu'on a un premier soin d'abord. It's better safe than sorry. Plutôt nous rapporter.
Yes, very true. It's better safe than sorry. Feeling sorry for having missed something dangerous. When I say here, the white discharge, which is excess flowing from the cervix, is an indicator for cancer. So when I take the tissue and study it, and in the meantime, we can make certain arrangements, or we can change the lifestyle pattern, advise and educate the women about the possibility of getting herself, the chances or the risk, or going in for the second level of treatment where there is, the latest one, the cryotherapy, where we don't have to remove the entire uterus or the cervix. The earlier the diagnosis, the easier the treatment is.
Earlier the detection, easier
yes,
the treatment.
Yes, always. The earlier the diagnosis, the earlier the gynae can or any doctor can treat. Prevention is better than cure, number one. Number two, early reaching out, early diagnosis lands up in safe treatment. Better safe than sorry, as Carol said.
Ladies.
Yes.
Okay, more question is, good morning, doctor. If you are experiencing dryness, what about KY jelly use? Is it normal to use?
Okay.
KY jelly?
Good morning to her. Say hi to her, bonjour. And experiencing dryness, and she can use the estrogen gel. That is what I think she is asking me, the local lubricating jelly that is used. Yes, it is advisable, because better to have something, the lubricating jellies are not allergic usually. They are very alkaline. Second, it coats the layer inside the vagina, and it doesn't allow the vagina to get broken during the sexual activity. Not only during the sexual activity, during her day when she is walking or standing for a long time, working during heavy duty works, the rubbing always happens. When the friction happens and the layer breaks, then she is exposed to infection. So little amount of lubrication can help the initial dryness. Definitely, it can help her.
Bien même, il va aider avec bien si, il nous dit que c'est là, nous avons aider avec dryness. Okay, the mom said thank you for your wait. She says again, it's me again regarding my daughter. She has let me see that one. She has Nexplanon 60 mg on the 21st February this year.
All right.
Is this a contraceptive?
Why can't she come and approach me in person? Because I don't really want to highlight on a particular medication and, put the wrong information out for the public. So it varies from person to person, Carol. It's best for the mom to bring her daughter and meet me anyway. I'm here until Samzala. So she can come and meet me, get an opinion from me, and I think I'll be able to guide her and, explain her or treat her well.
Mommy, what you do is just call Dr. Suganya, call Dr. Mouti, mettez rendez-vous avec Dr. Suganya avant d'y aller, le 28, là où on est capable de gagner un peu de guidance pour voir, bien si, pas inquiète, pas retirer doute à le docteur pour voir qui peut arriver, bien si. And I will take the last one. He says in Creole, bonjour, demande docteur, est-ce qu'il est normal pour moi gagner mon période pour 4 jours, mais 10 premiers des jours qui m'ont bleed, please, et ça dit les autres m'ont bleed very light.
All right, bonjour. And is it like she's putting in a way whether her period can be sometime heavy, sometime light.
Yes.
Yes. And she's asking whether is it normal.
Is it normal? Yes.
No, it is not normal.
It's not normal?
It's not normal to have a period which is sometimes heavy and sometimes light. A period average has to be where a woman has to experience.
She bleeds 4 days.
Yes.
The very first 2 days, it's heavy bleeding, and
Yes.
the next 2 days, it's
light
bleeding.
All right. It is like, we can put it in this way. The number of pads that is soaked per day is more important than communicating like heavy and light, because the average pad that has to be used per day is ranging from 3 pads per day.
Really?
Yeah, really. The 3 pads soakage is okay.
Maternity pads or normal pads?
Normal pads, not maternity. Yeah, the
After
3.
you change every 3 hours, 4 hours?
No, every 4 hours.
4 hours.
Yes, every 4 hours, because more than 4 hours, as I said, the sweat, the blood, the aeration doesn't happen inside. So women working for long duration needs to have this napkin change in a regular basis, has to have a timer, in fact, Carol, because forgetting to change a napkin is a dangerous criteria.
Yes,
because
very dangerous
these
indeed.
pads can attract the infectious organism, and having a heavy bleeding in the first 2 days is quite okay, and slowly tapering and finally settling down within 5 days, it's absolutely okay. But anything crossing 5 days, bleeding or light or heavy, continuous spotting, she needs to approach the
Not
gynae.
okay? It's not okay.
It's not okay.
It's not okay.
It's not
Voilà,
okay,
la,
okay.
la réponse pour question. And the last one, the viewer's asking. She knows the dating Creole. I will let her know. Let her say it. When will she be back again?
Okay. Mon père venait, c'est ça, octobre, I'm not getting it, sorry.
26.
Le 6.
Le 26.
Le 26.
Le 26 octobre.
Le 26 octobre. And mon père passe, in Sisal. I love spending time in Sisal.
Voilà.
Makata, Sisal.
Kota Cécile, il peut venir, retourne Cécile
Yes,
le 26 octobre qui pour retourner. Mais seulement là, il a là. Ou pas parce que après, à cause de tous les mois, il a. Mais seulement là, il a. Sinon, on est capable de gagner pour moi octobre à partir le 26, Dr. Suganya. Thank you so much for joining me this morning. Tiens plaisir.
Yes, it's an absolute pleasure, Carol, and I really thank all the viewers, and I really hope they understood the importance of wide discharge. And I'm here at Dr. Murthy's until the Samsela, so they can come and visit me at Dr. Murthy's, and they can always approach me. I can give them at least a guidance or what the women is going through. It's a nice, you don't have to be afraid to approach me, and it is always better to be safe than sorry, as taken from you. And merci beaucoup. This is Dr. Suganya SARAVANAKUMAR from Sugan Hospital, Chennai, signing off.
She always say that when she come on board. She always say that. Mais seulement, ladies, mesdames, nous, madame, s'il vous plaît, aucun quelque chose qui nous sentit abnormal, aucun doute qui nous peut voir, s'il vous plaît, contactez Dr. Suganya, gynécologiste, la semaine, au soir, le temps est venu, à partir du mois prochain, le 26 octobre, il pour là, bien sûr, pour une plus guidance, consultation, concerne nous, l'école, nous, madame, ça fait, il passe avec nous, nous-mêmes, nous pour un période, nous-mêmes, nous pour un ménopause, nous-mêmes, nous pour un white discharge, that's affaire, pour madame, it's too much for us, ladies. What about the men?
So much for the lady to go through.
We go through a lot.
From birth, and we are proud to
give
be.
birth.
We are proud to be a woman. We can give birth, and we are the only moms to be.
Yes, so much for us ladies.
So much
Too
for us ladies.
complicated.
Yes.
Dr. Suganya,
Yes.
it was an absolute pleasure. Thank you so much.
Merci beaucoup. Merci.
Yes,
And
yes.
see you soon. More where would tale or apale.
T'apprends créole, mauvais. Et c'est ça aussi, c'est une topic conversation.
Yes.